to this Facebook Live session. Today we are discussing an extremely important topic, an extremely important corneal condition that affects many individuals, and we'll discuss how we can treat it. I am Dr. Tushar Grover. I am the medical director and a consultant in cataract, cornea, and refractive surgery at Vision Eye Center. So, if you're wondering what keratoconus is basically a condition of the cornea where the cornea begins to weaken, begins to thin, and therefore affects your vision. It reaches a stage where even with glasses, you're not able to see clearly. And often in the most advanced stages, the last stage of treatment, of course, is only a corneal transplant. So today we'll discuss this topic in detail. We'll take questions as well. And if you or a family member is suffering from keratoconus, we would be happy to answer any questions that you may have and address any doubts that you may have. So let's begin. Can we start with the topics that we'll be covering and the questions that have been included in this session? Okay, I'm sorry, I was not able to see these questions earlier. So the first question is that my mother has this condition. Is it a serious eye condition? Well, of course, it is a serious eye condition. It also depends on what stage it is at. The important thing to know is that this condition tends to stabilize around the age of 30. So if your mother has this condition, it is likely that the disease has already run its course. It usually starts in the early teens and then it begins to stabilize in your late 20s, and usually after the age of 30 the disease has stabilized. So her vision will still be affected because of keratoconus. She might be suffering from visual disability where she's not able to see clearly even with her glasses, but the important thing to know is that it is unlikely to worsen at this age for her. So for her, what we need to think of is to give her good visual outcomes. The most suitable solution for her, if she's having visual issues because of keratoconus, is to give her specialized contact lenses. These contact lenses are meant for irregular corneas, such as in keratoconus, and they give you extremely good visual outcomes. So a lot of individuals who start wearing these contact lenses have vision as good as, you know, a normal individual with a healthy eye. So I would suggest get her evaluated. You don't need to worry about the condition worsening too much at this stage, but it's important to see what we can do to make sure that her vision is at least as close to normal as possible. And that is possible in today's time. That is doable in today's times with the advances that we have in terms of contact lens technology, in terms of all the other modalities that we now have for treatment of this condition. Okay, so another extremely important question is, how can I prevent keratoconus? So one of the most important things to do to prevent keratoconus is to make sure you don't rub your eyes. So there are various factors involved which are not in our control. Like there is a genetic component as well. So somebody who has keratoconus, their children are a lot more likely to develop keratoconus. But what we can do from our side, the most important thing, of course, is to avoid rubbing your eyes, because there is a strong association between eye rubbing and weakening of the cornea, which leads to keratoconus. Other than that, if you do have frequent itching and you do feel the need to rub your eyes a lot, it is likely that you have some allergy in the eyes and you need to see an ophthalmologist so that the allergy can be treated, and that again reduces the incidence of keratoconus. If you have been diagnosed as keratoconus, then again, extremely important to treat it as soon as possible so that we can prevent worsening of this condition. So these are the things that you can do from your side to prevent keratoconus. To summarize, most important is to make sure you don't rub your eyes. Okay, so अनदर क्वेश्चन इज केराटोकोनस ट्रीटमेंट का रिकवरी टाइम कितना होता है? तो केराटोकोनस ट्रीटमेंट बहुत तरह के होते हैं. जो सबसे कॉमनली ट्रीटमेंट दिया जाता है, जो कि इसको बढ़ने से रोकने के लिए दिया जाता है, उसे बोलते हैं कोलाजिन क्रॉस लिंकिंग, कॉर्नियल कोलाजिन क्रॉस लिंकिंग. ये एक तरह की सर्जरी है जिसमें हम राइबोफ्लाविन नाम की ड्रॉप्स डालते हैं, उसके बाद यूवी रेडिएशन देते हैं, ताकि हमारा जो कॉर्निया कमजोर हो गया है केराटोकोनस की वजह से, उसे वापस वो स्ट्रेंथ मिल पाए, ताकि वो आगे चल के और कमजोर ना हो. तो इसमें यूजुअली पहले 2 से 3 दिन ऑपरेशन के बाद दर्द होता है. वो एकदम नॉर्मल है. आपको एक पेन किलर दी जाएगी, कुछ ड्रॉप्स दी जाएंगी. तो पहले 2 से 3 दिन थोड़े मुश्किल होते हैं. जिस दिन ऑपरेशन होता है उस दिन दर्द ज्यादा होता है, फिर थोड़ा कम हो जाता है, करीब 3 से 4 दिन में ठीक हो जाता है. उसके अलावा आपके विजन में थोड़ी फ्लक्चुएशंस होना कॉमन है पहले 1 से 2 महीने, बट विद इन अ वीक आप कंफर्टेबल होगे. एक हफ्ता आपको थोड़ी प्रिकॉशंस लेनी चाहिए कि आंख में मिट्टी ना जाए, पानी ना जाए, आंख को मले ना. तो ये सब चीजें करना बहुत जरूरी है, और जो ड्रॉप्स आपको बताई जाएंगी वो आपने यूज करनी है. सो बहुत ज्यादा लंबा रिकवरी पीरियड नहीं है, बस सही प्रिकॉशंस और जो आपको इंस्ट्रक्शंस दी गई हैं आपके ट्रीटिंग सर्जन द्वारा, उनको फॉलो करना बहुत इंपॉर्टेंट है. Any other questions? Okay. So again, a very important question is, what age does keratoconus start? So most commonly keratoconus starts in teens, in early teens. So that is why if a child's vision starts deteriorating in their early teens, it is extremely important to get them checked. And then it keeps progressing. The age group of say 13 to 20 is the most aggressive usually, and in that time keratoconus tends to worsen a lot. And after that, in the late 20s, it begins to stabilize. And usually by the age of 30, in most individuals, keratoconus has stabilized. So whatever irregularity and weakness has developed in your cornea because of keratoconus in this particular time period will stay even longer, but it doesn't worsen beyond the age of 30. Okay, so another very important question is keratoconus genetic? Because somebody's father had it. So if your father had keratoconus, yes, you do have a slightly higher risk of developing keratoconus than another normal individual. It is not direct penetrance as they refer to in genetics, as in it doesn't mean that if your father has keratoconus, you have a 50% or a 25% chance of developing keratoconus, but the chances of you developing keratoconus are slightly higher than a normal individual. So if you do have a family history of keratoconus, I would strongly recommend that you get a checkup done frequently. Get yourself checked once in a year. And if your ophthalmologist does suspect the possibility of keratoconus in you, there are certain scans that are done to make sure that you do not have keratoconus, and those scans will make it very clear. So if you do have keratoconus, it will get detected. If you do not have keratoconus, that will also be very clear in the scans. So that's all you need to do. Any other questions? Okay. Important question is कि keratoconus के लिए कौन सा विटामिन अच्छा होता है? So कंजम्पशन के पॉइंट ऑफ व्यू से कोई विटामिन कंजम्पशन का ज्यादा रोल नहीं है केराटोकोनस में. ऑफ कोर्स जो हम ड्रॉप्स देते हैं सर्जरी के टाइम पे, वो एक विटामिन बी होता है, फॉर्म ऑफ विटामिन बी, जिसको राइबोफ्लाविन बोलते हैं. वो ड्रॉप्स दी जाते हैं उस सर्जरी के टाइम पे. बट इन टर्म्स ऑफ आपके कंजम्पशन, आपके सप्लीमेंट्स लेने से विटामिन का कोई रोल नहीं है केराटोकोनस पे. ऑफ कोर्स हैविंग सेड दैट, आपकी आंख एक हेल्दी बॉडी में ही रह सकती है. अगर हेल्दी आई आपको चाहिए तो अ हेल्दी आई ओनली लिव्स इन अ हेल्दी बॉडी. सो यू नीड टू मेक श्योर कि और कोई विटामिन डेफिशिएंसीज नहीं है आपको. आपके फिजिशियन से आप रेगुलरली डिस्कस करें अपनी ओवरऑल हेल्थ के बारे में, आपके विटामिन डेफिशिएंसीज के बारे में, और अगर कोई विटामिन में डेफिशिएंसी है तो उसका सप्लीमेंट्स लें, उसके लिए ट्रीटमेंट लें, बट उसका डायरेक्टली इस पर्टिकुलर कंडीशन से कुछ लेना देना नहीं. Is there any other questions? Okay, so an important question is, what are the disadvantages of surgical treatment of keratoconus? So essentially, surgical treatment for keratoconus can be of two types. The first type is when you're trying to prevent the worsening of the condition. So say, for example, an 18-year-old individual has keratoconus and we know that it is worsening. In that, you do a surgical treatment called corneal collagen cross-linking. Now, that is of course extremely helpful. The disadvantages are, you know, any surgery will have a minimal slight risk of infections, for example. So that risk of infection is there. Then the surgical treatment can also lead to slightly more haziness in your cornea because you are subjecting it to treatment. What is important, of course, is that you have to look at the benefits versus the risks. You have to see if the benefits outweigh the risks. And if somebody has progressive keratoconus, if the condition is worsening, then the benefits are much, much higher than the risks. And if the condition is not worsening, then the benefits are not more than the risks involved. And then it doesn't make sense to do that surgery because your risks are higher than the benefits. The other kind of surgical treatment that you would do for keratoconus is in the most advanced cases, which is corneal transplantation. So corneal transplantation has, of course, a lot of benefits. You know, if somebody is not able to see at all, it can really bring back light into their eyes, bring back vision into their eyes. It's a complete transformation, and it is really a joy for those patients. Corneal transplantation, however, of course, you do need to understand that it is another human being's cornea, another human being's part of the eye that is being transplanted into your eye. So there is a possibility that your body can reject the other individual's tissue. There is a possibility of infections as well. There is a possibility that that graft might fail. But of course, with any surgery, you do have some minimal risks involved, and it's important that you discuss with your treating ophthalmologist, weigh the benefits, weigh the risks involved, and then you and the ophthalmologist both together take an informed decision on what is the right treatment ahead for you. So the next question is, what is the success rate of keratoconus surgery? So the success rate of corneal collagen cross-linking surgery, which is to prevent the worsening of keratoconus, is extremely high. It's more than 95%. 95 to 97% of people who undergo the surgery do not have any further worsening of keratoconus, which is extremely good, which is extremely high, and the surgery itself is quite safe. It is quite effective, and you have pain for a few days. Okay. Okay, the next question is, क्या सनलाइट केराटोकोनस के लिए खराब होती है? तो सनलाइट का डायरेक्टली केराटोकोनस से रिलेशन नहीं है. ऑफ कोर्स उसमें जो हमारी यूवी रेडिएशन होती है सनलाइट में, वो हमारी आंखों को नुकसान करती है. तो सनलाइट से बचाना, हमारी आंखों को सनग्लासेस पहनना, यूवी प्रोटेक्टिंग सनग्लासेस पहनना बहुत इंपॉर्टेंट है. बट इस पर्टिकुलर कंडीशन केराटोकोनस से सनलाइट का डायरेक्ट रिलेशन नहीं है. Okay, what makes keratoconus worse? Again, an extremely important question, and extremely important to know that one of the most important things that makes keratoconus worse is eye rubbing, because you already have a cornea that is weak. If you rub your eyes, you will make it weaker, and that leads to worsening of keratoconus, which has a significant impact on your vision, and your vision tends to worsen with time if you keep eye rubbing. So, practical point of view, for you, that is something which is extremely important. Of course, there are a lot of other factors which are not necessarily under our control, such as genetic factors, such as hormonal factors. So these things you can discuss with your ophthalmologist, and based on your particular scenario, they'll be able to guide you. But one thing to remember is, do not rub your eyes. Okay, who is at risk for keratoconus? So keratoconus, like I said, there is a genetic component. Somebody who has a family history of keratoconus is more likely to develop weakness and develop keratoconus. Apart from that, there are a lot of systemic conditions like Down syndrome, like Ehlers-Danlos syndrome. There are a lot of conditions like that which are associated with keratoconus. So if you have any systemic conditions, again, it's important to see an ophthalmologist as well, so that you can be evaluated, and any associated conditions in the eye because of your systemic conditions can be detected and treated if it is needed. Okay, an important question is, क्या keratoconus permanently cure हो सकता है? So बहुत important question है, और केराटोकोनस में ये होता है कि आपका कॉर्निया जो है उसकी वीकनेस की वजह से शेप बदल जाती है. वो सर्कुलर होने के बदले एक कोन की तरह बन जाता है। तो उसको हम वापस नॉर्मल कॉर्निया नहीं बना सकते। उसमें जो कमजोरियां हैं वो कुछ हद तक रहती हैं। बहुत सारी ट्रीटमेंट ऑप्शंस हैं जिससे कि हम उसे बेटर कर सकते हैं। जैसे कि हम कुछ तरह के लेजर आते हैं जिससे कि हम कॉर्निया को कुछ हद तक रेगुलर बना सकते हैं। कॉर्नियल ट्रांसप्लांट से हम कॉर्निया को बदल सकते हैं। पर ये कह पाना कि हम उसको परमानेंटली क्योर कर देंगे और आपका कॉर्निया बिल्कुल एक नॉर्मल इंसान जैसा या वैसा हो जाएगा जैसे कि पहले था जब आपको केराटोकोनस नहीं था, वो सच नहीं है। तो एक वीकनेस रहती है, उसको हम बेटर कर सकते हैं, उसको हम इम्प्रूव कर सकते हैं ताकि आपको बहुत अच्छा विजन मिले। बट क्योर वर्ड बोलना कि हम इस प्रॉब्लम को पूरा हटा सकते हैं, वो पॉसिबल नहीं है। Okay. Another important question is, can I wear glasses with keratoconus? Yes, you can definitely wear glasses with keratoconus. In the early stages, if you have an early form of keratoconus or a relatively mild form of keratoconus, you might have good vision with glasses. So you can definitely just wear glasses. And as long as you are comfortable with your routine activities, there is no need to do anything else. However, if you have advanced keratoconus, if it is extremely severe, then glasses might not help you too much. So you can wear glasses if they help you a little bit, but when you have severe disease, then there are other options for treatment, and glasses might not be useful enough for you. Okay, the next question is, can I watch TV if I have keratoconus? Okay, again, very nice question. Yes, you can watch TV if you have keratoconus. There is no direct relation with watching TV and worsening of keratoconus. So go ahead, watch TV. But of course, you know, and we've discussed it multiple times in various sessions about the harmful effects that screens have in your eyes, particularly the harmful effects that prolonged screen usage has on your eyes. So remember that, keep that in mind, and take frequent breaks from screen use. Do not use screens continuously. But just because you have keratoconus, that is not any reason for you to not be able to watch TV at all. Is cornea surgery risky? Good question. If cornea surgery is risky, well, cornea surgery, I wouldn't call it risky. I would say it is an extremely skillful surgery, an extremely helpful surgery which provides extremely good visual outcomes. Does it have risks involved? Yes, of course. I mean, it has huge benefits, but it also has some risks involved. When you're talking about corneal transplantation, there is that slight risk of rejection happening, which can happen after a few months also, and it can happen even after many years. There is a slight possibility of infection. There is a slight possibility of that graft failing, which again might happen soon, or it might happen after many years or even decades. But in those cases as well, you can repeat the graft. You can do another corneal transplantation, even if your first corneal graft has failed. So in cases where a corneal surgery is necessary, I think you definitely don't need to worry about risks, because the benefits are much more than the risks. But you must know that there are risks involved. Like any other surgery, a corneal surgery also has certain risks involved. So I think that sums up, and we've had a pretty good discussion on keratoconus today. So we'll just sum up with a message for the viewers. So keratoconus is, of course, a serious condition. It is, of course, something which causes a lot of troublesome symptoms in a lot of individuals. It affects their vision to a great extent, where they are not able to manage their routine activities even with glasses. The important thing to know is that it can be treated. Your vision can be improved. Your vision can be made to be as good as a normal eye, at least almost as good as a normal eye, with the modalities that we have today. We have specialized lenses which are available, which can really improve the quality of your vision. The option of certain lasers to regularize your cornea is there. There are implants that are available which can be used for keratoconus to improve your vision. And of course, finally, there is also the option of a corneal transplant. So you shouldn't be in despair if you have keratoconus. It is a condition which has extremely advanced treatments available now, and you must see your ophthalmologist, your cornea specialist, and get treated for the condition. Again, one more important point that I discussed multiple times during this live session is that, especially if you have keratoconus, do not rub your eyes, because rubbing your eyes has been associated with worsening of keratoconus. So please don't do that. And of course, listen to your treating ophthalmologist and follow treatment after discussing with them. If you do need surgery for keratoconus, discuss the benefits with them, also discuss the slight risks associated with them, and then take an informed decision. So thank you.